So the improvement activities involved with this process will include assessing the workload of the discharge care coordinator nurse for the possibility of adding a second nurse. The numbers, um, leadership always talks about numbers, but we're truly looking at what does it take to truly coordinate the care of these patients throughout the discharge continuum, starting at 45 days until parole. And with so many variables in place, um, we truly need to look at that closely for that possibility. And if not, maybe a social worker as an added opportunity to get engaged with the discharge planning process and maybe take some of those patients away from the discharge planning nurse. Discuss demographic process to obtain information timely with parole agent leadership at 30 days from parole. This will require looking at the process in terms of how our parole agents are obtaining demographic data, at what times are they using an electronic system that our nurses can access, and are they responsive to any inquiries that our discharge nurse may have prior to discharge. So that does require an opportunity for improvement. Discussing parole date changes requires immediate notice to care coordination nurses. So if patients are paroling at 45 days and then they change it to 14 days, it cuts the time for linkage of services in the community by half. And as we've talked about before, we can't link our patients with a provider in a very short amount of time. At least not now. And we hope that in the future, as these services continue to expand and improve in the community, that'll cut the time from having a delayed response of a week to maybe a day or two. The last thing I think we could look at in terms of care coordination and follow-up appointments is developing a process that involves a social worker to truly look at all the aspects of the basic needs that the patient will need in the community, which dives right into the demographic information needed. They also work with parole agents, and they work to establish the social benefits we talked about with our TCMP providers, the basic human needs we spoke about, and the peer support opportunities that social workers may have more resources or understand the process more in the community than a registered nurse who is trained to look at specific criteria.